Thank you very much. My name is Rahul Sharma, and over the next 10 minutes, I'm going to describe to you our emergency medicine physician satisfaction and wellness program at New York Presbyterian-Weill Cornell Medicine. So our mission statement was to establish a committee to better understand our providers' concerns and work with hospital leadership to maximize physician well-being and increase job satisfaction while reducing stress and lowering the burnout epidemic plaguing our specialty. The reality is that happy doctors are the key to optimizing patient outcomes and patient satisfaction. And let me add, it should be happy doctors and nurses. I want to piss off the nurses. So let me give you a little background on burnout and emergency medicine. So emergency providers are 3 times as likely to suffer from burnout compared to our non-physician counterparts. Now, why is that? We have a high-intensity, stressful environment. There could be lack of social support, challenging work conditions, increasing volume. If you read the newspapers and all the data shows that year by year, the number of ED visits continue to rise nationally. And on top of that, you're required to make decisions rapidly. So this is one slide which I'm sure several of you have seen. It was a Medscape survey from 2017 on which specialties at highest risk for burnout. And we all like to be number 1, but I will tell you, this is something that we're not proud of. Emergency medicine physicians were the highest when it came to burnout. So now, we've heard all morning and afternoon, what are the impacts of burnout? Your job performance declines, you have physician attrition, you have poor physical health and mental well-being. You could have tumultuous relationships at work, but also at home. And then these negative attitudes could actually spill into other areas of the workplace. So with burnout numbers that high, it's clear that it's not an individual problem, but it's a problem of the work environment. So what did we do at New York Presbyterian-Weill Cornell Medicine? We defined the problems, we set objectives, we took action, and most importantly, we tracked progress. So what we did initially in September of 2016, we did a voluntary anonymous survey, the Maslow Burnout Inventory, as well as the Areas of Work Life survey for our faculty. This survey measures several factors, which include emotional exhaustion, depersonalization, impact of workload, and also values in the organization. Now, we found this extremely beneficial. Each provider that filled this actually got their own personal results, and this gave a great perspective of where they stand and where we stand as a group. Now, I like this slide. Now, this slide really sums up, it's called a Quadruple Aim. So traditionally, healthcare organizations, successful healthcare organizations always felt that there should be 3 goals: the best patient outcomes, lowest cost, and great patient experience. But what was really missing? The clinician experience. And when you want a successful healthcare organization, you must address the clinician experience. Because burnout will impact your outcomes, will impact your costs, and also your patient experience. So let me tell you a little about what we've been able to do over the last 2 years at our institution. So what did we first do? We first formed the Physician Wellness and Satisfaction Committee, initially of 3 faculty members, has now expanded to 7 faculty members. This committee meets on a regular basis, and I personally meet with the committee leadership to see how we're doing and what things we need to do to improve the current program. Now, one of the biggest successes we've been able to do is we've been able to implement breaks during our clinical shifts. So if you ask most emergency physicians, residents, you ask them, when do you get to take a break? Most of them will say, well, when I get time between patients, or I don't take a break at all. This has made a tremendous impact. I'll tell you, I did a clinical shift yesterday, saw about 2 trauma patients, 3 stroke patients. That 30-minute break that I took, where one of my other colleagues covered me, was so important. I came back, I felt refreshed, and I felt like I could take care of patients better. And now we do this for our residents as well as our PAs and nurse practitioners. We also had relaxation and relax and restore sessions before our faculty meetings. We had massage therapy, mindfulness, as well as meditation. Now, we've been talking a lot about documentation. And since we've introduced electronic medical record, it's been a double-edged sword. While I guess the handwriting's improved, you don't have to read doctors' handwriting anymore, it's great. But it's actually, what it's done, it's taken patients and doctors away from each other. One big complaint our faculty, our residents, everyone had was that they're spending more time behind a computer. So we implemented a medical scribe program. Each faculty member has a medical scribe, and this gives more time with the patient for the faculty member, but also for the residents to help them teach. We actually published our findings for the impact on scribes on education in the Journal of the ACGME this past year, showing that it actually impacts teaching at the bedside for our residents. Now, the physical work environment is also very important. So we had renovations both of our faculty lounge as well as our residency lounge. Now, we actually formed a peer support program for our faculty who are going through some personal issues, but most importantly, if you get named in a malpractice issue. If you get named in a malpractice issue, you'll ask most physicians, it's probably one of the most isolating times of your career. So we actually have a peer support group where we work with our faculty to support them. We also have wellness recharge events every quarter. I'll show you some pictures. But this wellness program isn't about just going out for the dinner and partying. This is really about staff supporting each other and having a multidisciplinary approach. And one of the most important things we've been able to do is have changes to our schedule. So, for example, we had a shift that ended at 1:30 a.m. I don't know about you, but getting home at 1:30 a.m., you basically miss dinner and you're going to miss breakfast with your family. So we were able to actually change one of those shifts to 12 a.m., and that actually made a big difference for our faculty. We've actually put some extra coverage, but another thing we've done is we've actually offered telemedicine shifts to our faculty, especially the senior faculty. And that gives them another opportunity to practice medicine in a different environment, and that's been one of the most rewarding experiences for our faculty members and has really improved both morale and satisfaction. Now, we wouldn't be able to achieve all these results if we didn't focus on our residents as well. Our residency program at NYP is a combined Cornell-Columbia residency program. And we're doing a lot to promote wellness in our residency program. Actually, in a few weeks, we're going to be having an entire theme day just focused on wellness, where we're going to be having lectures, small groups provided by faculty and other residents. As part of our clinical curriculum, we actually have well-being lectures focused on sleep, resilience, mindfulness, and burnout on an ongoing basis. Now, what I told you about the shift changes, we actually have done the same for our residents. For our junior residents, if you ask most residents that work in emergency medicine, in your junior years, you start off with 12-hour shifts. What we do now, all of our junior residents actually get one 8-hour shift a month where they'll end at 4 p.m. So at least once a month, they have time to be with their family, loved ones in the evening. And that's made a big difference. You all heard from Cleavon. He's actually one of my residents. I'm sure he'll say he loves that 8-hour shift. Also, one of our other residents, Dick Scher, is here as well. That's made a big difference. We also have a 2.5-day outdoor education wilderness retreat for our junior residents, for our interns, where they go out up to Ithaca and they focus on team building and collaboration. We have a friends and family dinner. We have an active big SIB, little SIB program. We have dedicated retreats for our PGY1s, PGY2s, and then we have an all-day retreat for all our residents where they're excused. So I'm sure you know how our faculty feel when there's no residents working in the ED. But the residents have an entire day where they do team building in the morning. In the afternoon, there's a barbecue, which our program director told me that he cooks. So some of our results include we've had improved our MBI scores in several of the disciplines from the survey, and we're going to administer the survey again this third year to see how we're doing. Our staff engagement scores have improved. And when I mean staff engagement, I'm not just talking about physicians. I'm talking about the clerks, the techs, the nurses, and everyone. Now, why is that important? Because if you have happy doctors, that is going to then result in overall happier staff. They communicate better, and that results in better patient experience. Now, you might be asking, all of these changes, what does it do to your operational efficiencies? So we actually, in emergency medicine, you'll know that we're required to report certain metrics, how soon you see a provider, what's your walk-up rate, and all these other things. I'm happy to report at the Weill Cornell campus, our door-to-provider times are 9 minutes, probably some of the lowest in the country. Our walk-out rate is 0.5%. Now, while these are numbers, this really is a testament to all the great work our frontline staff are doing. It's really the result of all the great work. We have supported them, and they are able to deliver excellent care to our patients. Our findings from our wellness program were also published in Physician Leadership Journal this past year. So this is just some pictures of some of the recharge outings that we've had, which include a cruise around New York City. We have dinners, and this is with residents, with nurses, with everyone else. It's really, wellness has been promoted at all levels. Now, this is what the faculty lounge used to look like before. Now, after some renovations, this is a welcoming and functioning and functional environment where you have a privacy, you have a room, and we actually even put a massage chair in there. It's not that expensive, actually. So while we have made great progress, we know we still have more work to do. We want to continue our wellness events to promote feelings of community and family within the department. We just completed an open-ended survey to engage faculty for ideas to promote change. As David Rock wrote in 2009, people rarely support initiatives they have had no part in designing. We make sure that our frontline staff are involved in the planning and the implementation. You can't just tell people what to do to improve wellness. You actually have to get feedback from them, and they have to tell you. And you, as a leader, have to sit back and say, all right, let me see if this is possible. We're going to continue to have future presentations, publications to assess how we've been doing. Scheduling is a big issue, so we want to continue to promote scheduling changes. And we want to promote wellness on more of a national level, work with ACEP, American College of Emergency Physicians, and other organizations. 2 of our members are actually on the ACEP National Wellness Committee. So I want to thank everyone at New York Presbyterian and Weill Cornell Medicine, most importantly, my physician colleagues, Dr. Lucy Willis, Dr. Renu Mittal, and Peter Steele, who helped spearhead our initiative. Thank you.